capacity to pay for it. And the argument of healthcare economists is it doesn't matter how much healthcare you provide, that the society, you spend 4% or 15% of your GDP on healthcare, people will want more. It's the nature of healthcare. And that over time, this situation will get worse. So healthcare in all countries is becoming more expensive. It is an unavoidable reality of healthcare. And it is the central dilemma of healthcare. Well, then this kind of leads to a question, which is, well, if you don't do anything, then what happens, right? I mean, healthcare just keeps growing and growing and growing until it eats the entire economy. I mean, what happens? What do we do? How do we contain costs? How do we keep this from happening? And this then opens up the question of healthcare rationing. The suggestion is that we want so much healthcare that we will consume the entire economy to get it. If given the opportunity, we'll just use it and use it and use it and use it and use it, and it won't stop. And so healthcare costs will continue to grow. And so the question becomes, well, how do you maintain that excess demand? How do you maintain or restrain infinite demand for healthcare? And then this is a question of rationing. Now, rationing is a really bad word, right? I mean, you don't want to say rationing like company. I don't know you well enough to tease you, I'm sorry. But rationing, is this kind of boogeyman kind of concept. And we think rationing is awful because we, of course, associate rationing with times of extreme shortage, right? That rationing occurs when there's not enough to go around, and so the government kind of scrimps and decides and kind of parcels out little pieces to every single person. And so we associate it with an incredible amount of shortage. And partially that's correct, is that rationing does occur when there is shortage. But what I mean by rationing is a much more kind of broad concept. And that rationing involves any mechanism for distributing a scarce good. That any good that exists in society which is scarce. And what we mean by scarce is that the demand for it exceeds the supply, right? So I don't mean that there's not a lot of it out there. What I mean is that we want more of it than we have, right? At any time that happens, we have this problem in society. There's not enough to go around. And so when we don't have enough to go around, we have to come up with some solution, right? How are we going to decide who's going to get it? Make sense? So, and this is true for any good. It's true for anything out there in society, right? It's true for televisions and iPods. It's true for food. It's true for housing. It's true for healthcare. Any good that's where demand exceeds supply, where there's this shortage being generated, we have a question of how are we going to distribute that good? Make sense? So this then suggests that healthcare rationing is inevitable. And I want you to be clear on that, because I've always misunderstood at this point. What I'm arguing is that healthcare rationing is inevitable. It is, and I don't mean that healthcare rationing will one day happen to you. What I mean is that healthcare rationing is happening to you now. It's an inevitable part of dealing with a resource that is scarce. Healthcare rationing is inevitable. It exists in all societies and always will, because we have a scarcity of that resource. Make sense? Now, two-step process. Okay? So the first step of the process of rationing any good is we first decide, well, how much are we going to make? Right? There's a limited amount of resources we have for making things. We all want different things, right? We all want lots of different stuff. And so we have to decide first how much of anything are we going to make? Right? So that's question number one. How much do we make? Then question number two is, how are we going to decide how to distribute what we make? Okay? And so rationing involves these two questions. So the first one is how much. The second one is who gets. Right? And any good that's in scarce supply, any good that's not readily available, anything basically besides air, these questions will have to be answered, and every society will be required to do so. Make sense? So then the question is, well, how do we make those choices? How do we decide how much and who gets? On what basis do we do that? And there are a number of different mechanisms for doing that. Now, the first method that might come to mind is the method of the market, is that we would let the market decide. And in healthcare economics, we call this price rationing. Price rationing. The price rationing is, look, there's a scarce good, right? Then what we do is we have an auction for said scarce good, right? And there's only so much to go around. We have an auction where everybody says, I'll pay this much for it, I'll pay this much for it. And we have this kind of auction, right, where we determine who's willing to pay for it. And eventually, we kind of get to this price, this certain price for that good. And this is, again, it's true. You know, the newspaper is true, which is, you know, technically worth nothing, I guess, these days. Right? It's true of, you know, iPods and televisions, everything else, right? So we have kind of this bid, and then we come up with this price, and that's the price for the TV, it's the price for the iPod, it's the price for healthcare. Now, the thing about this price is this price actually solves the rationing problem. It solves both questions of the rationing problem simultaneously. The first thing is this question of, well, how much? And the how much is determined by people who would produce that good, and they see what the price is, and they say, well, I'll produce as much as I think I can profitably at that. Right? Once we've determined it, it's set. Then once we've determined the price, then we've determined the supply. And then, of course, simultaneously, we've also answered question number 2, who gets? And the who gets question is answered by, well, whoever's willing to pay, right, or able to pay, right? So price rationing, the market, solves this rationing dilemma through the function of price, and therefore solves both of these questions simultaneously. Right? You open it up to the market and say whatever people can buy, that's what they can get, and whatever is supplied at that price, that's. Now, there's an interesting thing. Now, I want to see first is to make clear is when we say there's price rationing, right? Is to see that price rationing using the market is not avoiding rationing. It's using a particular mechanism for doing so, the market. To make this is kind of bizarre for a lot of us, and the reason for that is because we have grown up, we have learned to think of the market in a very bizarre way, which is that we think of markets as if they're kind of natural, right? They're these kind of pre-existing thing, the market. You know, it's like on day 1, God made the heavens and the earth, and on day 2, He made the market. Right? And we have this kind of sense that the market is the natural way of things. And so then the idea is, of course, that if you don't do anything, then the market is doing it. And then there's the question of, oh, we can have the government interfere with the market. Right? That's our typical kind of understanding. It's the market's kind of the natural way of being, and the government gets in there and screws stuff up. Right? Or if you're a socialist, it goes in there and saves us all. You know, either way, there's still this idea that the market comes first. But if you think about it, this in fact is just not true. And in fact, doesn't make any sense at all if you think about it for a few seconds. And I'll give you an example to make this quite clear why the market's not natural, not pre-existing. And let's say, you know, if I walked in here, and I should have, with a couple of lollipops. Let's say I just walked in here with 3 lollipops, right? And of course, now I've created this situation where I would say, let's everybody eat lollipops. But of course, we can't all eat lollipops. There's a shortage. There's not enough lollipops to go around. Right? So now we are in a situation of scarcity. So now we have to decide, well, there's not enough lollipops to go around. How can we do it? Right? How can we decide who's going to get these? And of course, one solution we could do is we can have an auction where I can stand over my lollipops and say, who wants to buy a lollipop? Highest bidder gets a lollipop. Right? And of course, that's one way to do it. But the rest of you doing it, you might think I was a little bit of a jerk. Right? But I mean, I could do that. And that would be the market solution, right? Of course, I can also just go up here and say, you know what, it's not fair that we're going to do that, so I'm just going to close my eyes and toss the lollipops in the air, and whoever